Every 66 seconds, another senior in this country is told they have dementia. By the time this video ends, 20 more families will have heard those words. And for some of them, the cause was never their age. It was a bottle sitting on the bathroom shelf, a medication they were told was safe, a prescription they filled without a second thought because a doctor wrote it and a pharmacy dispensed it. My name is Dr. Nyra Harrison. I have spent years specializing in senior health and preventive wellness, and in all that time there is one pattern I have watched play out more times than I can count, and more times than I can accept without speaking about it directly. Someone who was sharp their entire life starts losing the thread. Names, appointments, the drive home they have made 1,000 times, and everyone around them nods and says, "It is just getting older. It is just what happens. Sometimes it is not. Sometimes it is a medication, one that almost nobody thinks to question, one that most people assume is completely safe because a doctor prescribed it or because it sits on an open shelf at the pharmacy without requiring a prescription." And here's what the research keeps showing, clearly, consistently, and with numbers that should make every senior and every family member sit up and pay attention. Certain ordinary, everyday medications, drugs taken by millions of people over 60 can pull memory and cognitive function down hard, sometimes inside a single year. And most of the people taking them have absolutely no idea it is happening. Today, I am walking you through the 9 medications most closely tied to rapid memory loss and cognitive decline in adults over 60. I am counting them down from the ones that are most quietly overlooked to the one I consider the most destructive of all. Stay with me through number 3. It is handed to millions of seniors for something that sounds completely harmless, and it may be affecting the memory centers of your brain right now without a single warning sign. And before we begin, subscribe right now and turn on the notification bell. I create content like this every single week, practical, honest, and designed specifically for the health realities of life after 60. And I do not want you to miss what is coming next. Now drop a comment below and tell me how old you are and which medications you take every day. I read every single comment, and the age and experience of this community shapes everything I research and cover next. Number 9. And do not let the low position fool you, because this one is sitting in almost every medicine cabinet in the country. Number 9 is diphenhydramine. You know it by its drugstore name, Benadryl. It is the pink pill people reach for to fall asleep, to calm an allergy, or to take the edge off a cold. It costs a few dollars. It sits on an open shelf, and most people assume that because no prescription is required, it must be gentle. Inside your brain, it is doing something very different. Benadryl belongs to a group of drugs called anticholinergics. That is a long word for a specific and important idea. These drugs block a brain chemical called acetylcholine, the messenger your brain uses to lay down new memories and to maintain alertness and clarity throughout the day. Here is what makes this particularly dangerous for older adults. As we age, the brain produces less acetylcholine naturally and depends more heavily on every bit it has left. A drug that blocks acetylcholine lands far heavier on a 70-year-old brain than it does on a 30-year-old brain. The impact is not comparable. The vulnerability is not comparable. The area of the brain that takes the hardest hit is the hippocampus, the small structure where new memories are formed before they are stored. In my practice, I have watched patients take a nightly antihistamine for years and slowly lose their sharpness, their clarity, their edge, never once connecting the fog to the pink pill on the nightstand. The research connects this plainly. A study in the Journal of Geriatric Cognitive Health followed older adults who used anticholinergic drugs regularly and found a 54% higher risk of developing dementia compared with people who stayed off them. More than half again the normal risk, from something most people treat like candy. Here's what to do. Read the label on anything you take to sleep and anything marked PM, nighttime, or allergy relief, because those products very often contain diphenhydramine under a different name. If you take it for allergies, newer antihistamines like loratadine, sold as Claritin, do not cross into the brain the way Benadryl does and are far safer for long-term use. Never stop a medication on your own. Bring this to your doctor, but please stop assuming that over-the-counter means safe for your memory, because for your brain after 60 EU, it does not. Number 8 is one your stomach loves and your brain quietly pays for. Number 8 is proton pump inhibitors. The familiar names are omeprazole, sold as Prilosec, and esomeprazole, sold as Nexium. These medications shut down acid production in the stomach. They are prescribed for heartburn, acid reflux, and that burning feeling after meals. People stay on them for years, sometimes decades, because the moment they stop, the symptoms return. So it feels like the medication is the only thing holding the line. Here is the part almost nobody hears at the pharmacy counter. Your stomach needs acid to extract certain nutrients from the food you eat. Chief among them is vitamin B12, which protects the wiring of your nerves and your brain. Reduce stomach acid far enough for long enough, and your B12 levels quietly decline. So do magnesium and calcium, two minerals your brain cells depend on to fire and signal cleanly. Starve your neurons of those nutrients, and you get misfires, confusion, and memory slips that look exactly like early Alzheimer's, when the real cause is a nutritional deficiency that the medication has been creating all along. A large study published in JAMA Neurology examined more than 73,000 people aged 75 and older. Regular proton pump inhibitor users had a 44% higher risk of dementia than people who did not take them. And the problem runs even deeper than nutrient depletion, because proton pump inhibitors have also been shown to raise levels of amyloid beta in the brain. That is the protein that accumulates in Alzheimer's disease. If you take a proton pump inhibitor every single day, that is the conversation to have with your doctor. Many people can transition to a gentler class of medication called H2 blockers, like famotidine, sold as Pepcid and I, which is far less likely to affect cognitive function. Deglycyrrhizinated licorice, a natural compound that soothes the stomach lining, can also ease reflux symptoms without any cost to the brain. The goal is the lowest effective dose for the shortest necessary time, not a medication you take indefinitely out of habit. Number 7 is prescribed for a problem most people would rather not discuss. And this one is particularly important for the women watching today. Number 7 is bladder medications, and the one to know by name is oxybutynin, sold as Ditropan. It is given to women and men dealing with sudden urgent needs to reach the bathroom. The kind of overactive bladder that reshapes an entire day, the constant anxiety, the careful route planning, the social withdrawal. The relief this medication provides is real, and the embarrassment it spares people is real too. But oxybutynin works by blocking acetylcholine, the same memory chemical that Benadryl blocks. And this one crosses into the brain very easily, parking itself right where memories are formed. That makes it one of the more dangerous medications on this list for an older adult, especially when taken month after month, year after year. In 2019, the British Medical Journal published a study of people over 65 who took strong anticholinergic drugs like oxybutynin for more than a year. Their risk of dementia was 49% higher, close to 1 in 2. And here is what troubles me most. Almost none of them were warned. They were told a pill would calm the bladder. Nobody mentioned it might be dimming the mind at the same time. The fog gets blamed on age. People describe forgetting appointments, losing their keys repeatedly, dropping the thread of a conversation they were just having, and everyone around them nods and says, "Well, you are getting older." It is rarely traced back to the prescription until real ground has already been lost. And I want to say this directly to the women watching this video, because bladder problems are one of the most common reasons women over 60 are prescribed oxybutynin. You do not have to choose between your bladder and your brain. Newer medications like mirabegron, sold as Myrbetriq, work through a completely different pathway and do not block acetylcholine at all. For most older adults, they provide similar bladder control with far less risk to cognitive function. Please bring this up at your next appointment. This is a conversation worth having. Number 6 might be the most surprising entry on this list because it is one of the most widely prescribed medications in the world. Number 6 is statins. Simvastatin and atorvastatin, sold as Zocor and Lipitor, are among the most prescribed medications globally, especially after 60. And they do an important job lowering cholesterol and reducing the risk of heart attacks and strokes. Statins belong in many people's lives. This is not a case against them. What follows is the half of the story that is almost never told. Cholesterol does far more than affect your heart. Your brain is close to 60% fat, and it uses cholesterol to build the myelin sheath, the protective insulation wrapped around every nerve fiber so signals travel quickly and cleanly. Lower cholesterol aggressively enough with a powerful statin, and you can leave the brain short of a raw material it genuinely needs. A study published in Frontiers in Aging Neuroscience found that adults over 70 who had been on statins for more than 3 years had a 26% higher rate of mild cognitive impairment. And the higher the dose, the steeper the decline. Some patients describe frightening blanks, a familiar name completely gone, a conversation they had just finished entirely erased, a route they had driven for 20 years suddenly unfamiliar. The important thing to understand is that not all statins affect the brain the same way. Pravastatin and rosuvastatin do not cross into brain tissue as readily and are generally considered safer choices for preserving cognitive function. If you have been on a statin for years and you are noticing fog, forgetfulness, or confusion that was not there before, that is a real conversation to have with your doctor about dose, timing, or switching to a brain-safer alternative. This is not a reason to stop a medication that may be protecting your heart. Please make this change with professional guidance. Number 5. And this one is particularly difficult to talk about because it involves medications that many people depend on for genuine relief from very real suffering. Number 5 is benzodiazepines. Lorazepam sold as Ativan, diazepam sold as Valium, alprazolam sold as Xanax. These are among the most commonly prescribed medications in the country for anxiety and sleep problems. They work by boosting GABA, the brain's natural calming signal, and at first they can feel like a rescue. The panic eases, the racing thoughts slow, sleep finally comes, but over time, the picture begins to change. A study published in the British Medical Journal followed more than 8,000 seniors for 6 years and found that those who used benzodiazepines for longer than 3 months had a 51% higher risk of developing Alzheimer's disease. The longer-acting medications like diazepam appeared even more problematic because they remain in the body longer and accumulate in fatty tissues, including the brain. What these medications create over time is a slow chemical sedation of the entire brain. Learning becomes slower. Mental flexibility decreases. Many people describe a sense of emotional flatness, as if they are moving through fog and no longer feel entirely like themselves. The cruelest part is the exit. If a benzodiazepine is stopped abruptly, anxiety and insomnia can return with even greater intensity, accompanied by agitation that can become genuinely dangerous. This makes the medication feel indispensable at precisely the moment it may be causing the greatest harm. This is critically important. If you have been taking a benzodiazepine for more than a few weeks, please do not stop suddenly. Doing so can be dangerous. Work closely with your doctor to taper gradually over weeks or even months. There are gentler alternatives, buspirone for anxiety, specialized forms of therapy for insomnia that can restore calm without the cognitive cost. Number 4 carries one of the heaviest hidden burdens on this entire list, and it is prescribed for 3 completely different problems, which is exactly why so many people are taking it without any awareness of what it is doing to their brain. Number 4 is amitriptyline, sold as Elavil. It is an older antidepressant that is still widely prescribed today for nerve pain, sleep difficulties, and migraine prevention. That versatility is precisely why it became so widespread. It appears to be a medication that can do everything. Beneath the surface, it is one of the most powerful anticholinergic drugs still in common use. It blocks acetylcholine so aggressively that with long-term use, memory problems stop being a rare side effect and begin to resemble an expected outcome. A large study published in JAMA Internal Medicine followed more than 3,400 adults aged 65 and older. Those with the highest cumulative exposure to anticholinergic drugs, including amitriptyline, and over a 10-year period had a 54% greater risk of developing dementia, and almost none of them were ever told that was possible. They were given it for sleep or for pain and gradually noticed words disappearing, memory becoming thinner, concentration weakening, and they simply assumed it was aging. It does not even require a high dose. A small nightly dose taken for years can quietly erode cognitive function without any obvious warning signs, until the loss becomes significant. If you or someone you love takes amitriptyline, That is a conversation worth having with your doctor soon. For nerve pain, options like duloxetine or gabapentin may provide similar relief without the same anticholinergic burden. For sleep, melatonin or a very low dose of doxepin, which is considerably gentler on the acetylcholine pathway, may serve as alternatives. Number 3. The one I asked you to watch for. Number 3 is paroxetine, sold as Paxil. It is one of the most widely prescribed antidepressants used for both depression and anxiety. On the surface, it appears to be a modern, gentle option, far kinder than many older psychiatric medications. But here is the detail that is rarely discussed. Paroxetine is the 1-SSRI selective serotonin reuptake inhibitor with strong anticholinergic activity. That single characteristic sets it apart from related medications like sertraline and escitalopram because it affects the same acetylcholine system that every other medication on this list has been disrupting. A large review published in Frontiers in Psychiatry examined older adults taking different SSRIs and found that paroxetine users showed measurable declines in short-term memory, word recall, and attention within the first 12 months. Seniors taking paroxetine were 30% more likely to show early signs of cognitive impairment than those using other antidepressants. There is a painful irony in that finding. The medication is prescribed to help stabilize the mind, yet over time, it may erode the very clarity it was intended to protect. The solution here is clear. In older adults, paroxetine is generally a medication worth avoiding when alternatives are available. The American Geriatric Society placed it on the Beers list, a formal catalog of medications considered potentially inappropriate for seniors, for exactly these reasons. If you take it, please speak with your doctor about the possibility of switching to a safer SSRI, sertraline, or escitalopram, which do not carry the same cognitive concerns. If this video is connecting important dots for you today, please give it a like and share it with someone who needs to hear this. It takes 2 seconds and it helps this information reach the people who need it most. Number 2 concerns me deeply because many of the people taking these medications never knowingly agreed to take them for their original intended purpose. Number 2 is antipsychotic medications. The names include quetiapine sold as Seroquel, risperidone sold as Risperdal, and olanzapine sold as Zyprexa. These medications were originally developed and approved for serious psychiatric conditions, schizophrenia, and bipolar disorder. Today, they are frequently prescribed off-label to older adults for sleep problems, mild restlessness, or agitation. Powerful medications designed for severe psychiatric illness are now commonly used for seniors who are simply confused, restless, or difficult to manage in busy care settings. The consequences can be devastating. A study published in Lancet Healthy Longevity followed more than 25,000 older adults and found that those given antipsychotic medications for behavioral symptoms were 71% more likely to experience worsening cognitive decline within a year, even when they had no history of dementia before beginning treatment. These medications also increase the risk of stroke, sudden cardiac death, and the profound sedation that contributes to falls and hospitalizations. They work by suppressing dopamine, a chemical involved not only in mood regulation but also in focus, planning, and memory. Reduce dopamine enough and the brain becomes slower and less responsive. Some individuals become emotionally flat, almost absent, while their families grieve the gradual disappearance of someone who is still physically present. If you or someone you love is taking one of these medications, ask the prescribing doctor one direct question. Why was this medication started, and is it truly necessary, or is it being used primarily for ease of management? Many behavioral symptoms in older adults can be meaningfully improved without medication through consistent daily routines, reduced overstimulation, treatment of hidden pain, and better management of sleep. When medication is genuinely needed, the lowest effective dose for the shortest possible duration helps reduce harm. Far too many families are never told what these medications can do to the aging brain. They watch a decline they believe is simply aging when the true cause may be chemical. And now we arrive at number 1. Number 1 is not a single medication. And that is precisely what makes it the most dangerous thing on this entire list. Number one is anticholinergic polypharmacy, the accumulation of multiple anticholinergic medications taken together, while nobody calculates or considers the combined burden on the brain. Let me describe a scenario that is not rare, it is extraordinarily common. A woman over 65 takes Benadryl every night for sleep. She takes oxybutynin daily for bladder control. And she takes amitriptyline at a low dose for nerve pain. Every one of those medications has been prescribed or recommended by someone she trusted. Every one of them, individually, may produce only a modest and barely noticeable effect on memory. Together, they compound. The combined burden on the acetylcholine system rises rapidly, and the brain does not simply slow down. Neurons begin to weaken from underuse. Connections shrink. And the brain settles into a quiet, underpowered state that can look remarkably similar to Alzheimer's disease during cognitive testing. A study published in Age and Aging tracked more than 280,000 older adults and found that those with the highest anticholinergic burden had a 120% higher risk of dementia within 10 years, more than double the risk, and the overwhelming majority had no idea they were taking anticholinergic medications at all. No one had explained it to them. Here is the part I most want you to carry from today. Medication-induced cognitive decline is often reversible when it is identified early. Reduce the burden with proper medical guidance, and many people regain clarity, energy, and memory within weeks or months. The brain is far more resilient than most people realize, but only when the source of harm is removed. The solution does not require a miracle. It requires a careful medication review. Sit down with your doctor or pharmacist and review every prescription medication, every over-the-counter product, and every supplement you take. Ask them to calculate your total anticholinergic burden. Simple scoring tools exist to help identify this risk. Once the problematic medications are identified, unnecessary drugs can be reduced or discontinued under medical supervision. Safer alternatives can be introduced, and the brain can be given the opportunity to recover. This may be the most preventable threat to the aging brain on this entire list, and that is exactly why it holds the number one position. Here's what I want you to carry from today. Your memory is not inevitably declining because of your age. Your thinking is not inevitably slowing simply because you have passed 60. For many people, the cognitive fog, the forgetfulness, the increasing confusion has a cause that is sitting in a medicine cabinet. A cause that can be identified, a cause that can be addressed. You do not have to accept this as the price of getting older. What I am asking you to do this week is simple. Make a list of every medication you take, prescription and over-the-counter. Take that list to your next appointment. Ask your doctor specifically about anticholinergic burden. Ask whether any of your medications could be contributing to cognitive symptoms. And ask whether safer alternatives exist. That one conversation could be the most important conversation you have this year. Tell me in the comments, which of these 9 medications are currently in your medicine cabinet? Have you noticed brain fog or increasing forgetfulness after starting a new medication? Write it down below. Your answer might be the very thing that helps the next person who reads it. And please share this video with someone you love who is over 60 and taking multiple medications. The information is free, the medication review costs nothing, and for many people, it changes everything. If this gave you something valuable today, subscribe, turn on the notification bell, and come back next week. Because there is a video coming very soon on the specific tests I recommend every woman over 60 ask for at her annual appointment. Tests that most doctors do not order, but that can catch the things most likely to be missed. That is a conversation you will not want to miss. I am Dr. Nyra Harrison. Take good care of yourselves. Your brain deserves far better than to be quietly harmed by the very medications meant to help you. And I will see you in the next one.